All right. Good morning, everyone. We'll get started. Did it say recording on anyone else's end? Didn't prompt
Yes,
it
I
for me.
see it.
Okay, great. Because on my end, it didn't prompt it and it usually does. All right. So good morning. Welcome to the April meeting for the Brooklyn Developmental Disability Council. Appreciate everyone being here. Finally starting to warm up. Hopefully everyone's enjoying this nice weather. Took long enough. Couple bits of business today. Unfortunately, we don't have any presenters. We will have updates from OPWDD. I see Nina. We have updates from IAC. We have Kate. And we'll obviously have time for agency announcements. But the first update, not going to say most important, but very important update. We have our fair coming up in June. So if you haven't registered for the Brooklyn Council Family Support Fair, it is Wednesday, June 18th, back at Brooklyn College. Um, I thought you were getting inundated with emails about it, but I know I was having some security issues, so I apologize. I will resend them where they're not secure. You will not need a password. But you can also find it on our website, bkddcouncil.org. It is a link to a Google form. It is free for families, individuals, professionals. You only have to pay if you're looking for a table as an agency. We do have 6 sponsors, so we are not accepting any more sponsors. That was a great response. We got very quickly. We are very appreciative of all of our sponsors. They are shouted out on our website with links directly to each of them. But if you know if you're an agency looking for a table, all the information is there. You can register right online, and then you have to send in a check with all the directions, again, being on our website and that link on the Google form. If you have any questions, you could always reach out to me directly. So June 18th, Brooklyn College from 9:30 to 2, and there will be light refreshments like last year. All right. Other council news. So this June we are due for our officers' elections. So as part of our bylaws, every 2 years, the officers have to be either reelected or new officers have the ability to run, but we have to have an election unless there's no one running against any of us. So this year, the only change that we're aware of at this point is our current secretary, Marion Resnick, is no longer interested in maintaining the secretary role. And Nigel Thompson from Kindred Bakery, who has been supporting the council and part of one of our subcommittees for the legislative committee, is interested in taking that role. I am still interested in being the chairperson. I think all the other officers are still interested in their roles. Rochelle, I don't know. I don't see you shaking your head yes. But Rochelle is the parent vice chair. Marjorie is the provider vice chair. And Chris is our treasurer. So the only change at this point on the election would be Nigel replacing Marion. If anyone is interested in running against any of us or for any of the positions, obviously you are more than welcome. You had to have attended, I think it's 3 meetings, at least 3 meetings throughout the year. And if you are interested in running for a position on the council, then you would have to email Deborah Greif. Deborah, can you put your email in the chat when you get a chance? Deborah is going to be overseeing the election committee, so you can email her if you are interested in running. And then if no one else is interested in running, we'll just open it up at next month's meeting, and we would just need one vote to take the slate as it is if everyone's running unopposed. But it's just part of the process and part of the requirements to make sure we're doing everything as we are supposed to. I got the election covered, I got the fair covered. Any updates, or Rochelle, do you have any updates from the what is it, the family meeting you usually sit in on?
Yeah, a brief update. We did have a family stakeholder meeting with OPWDD leadership last month. Um, I think the main substantive item, a lot of what we hear is the commissioner's reports and OPW, and I'm sure part will be covered by what Nina is going to present today. But the substantive item that was discussed more was the recent ADM on the Certified Residential Opportunities list, the CROW list. And some family members raised some concerns. First of all, we feel like it was positive that there is now a written ADM instead of just guidance. and that it's very specific and it has a lot of detail about who has to do what, when, and how, and how to, in what systems, and all of that. So, clarifying all the roles is good. One of the things that has been in guidance that is now written in the ADM is that for care managers must, in the course of life plan meetings, discuss available non-certified options before people are able to go onto the CROW list. And that has to be documented within the record in the CCO, so that the emphasis is on trying to promote more non-certified options for individuals. There are concerns about the adequacy of the availability of certified options for people who do require certified options, and that was expressed during the meeting. What was also expressed during the meeting was there's language that indicates, and this is all, of course, from a family perspective, there's language that indicates that there will be medical or justification or criteria for inclusion on the certified residential list. And we inquired what those would be. And there is no specificity in the ADM, nor was any provided during the meeting. We were assured by Anne Marie Peterson, who oversees this project, that of course there would be collaboration and people can challenge if they were not permitted to go onto the CROW list. But they're still concerned that there's not transparency about the criteria. And and the final thing is, which is a positive thing, that a person who applies to be on the CROW list would get a notice of decision about whether they're included or not. And if they are denied, there is an option ultimately of a fair hearing right, which did not exist before. We did, however, raise the concern that it is difficult for an individual or their advocates to prepare for a fair hearing if it's not clear what the criteria are for being included in certified residential in the first place. So this was an unresolved discussion. These were some of the concerns that were raised, and I would certainly be happy to hear concerns from other family members, because we have the option of continuing this discussion at our upcoming meeting next month. So let me stop and see if anybody has any questions about that. Okay, that's me.
I
And
raised my hand.
oh,
This
okay.
one, can you just give me what is the acronym of CROW, please?
Certified Residential Opportunities.
Okay, so it's CRO, correct?
CRO, CRO, yes. No W.
Thank you. Just making sure I wanted to make sure I was hearing it right. Thank you.
You were.
Rochelle, this is Carrie. What was the other acronym you used? ABM or?
ADM, that's an administrative memorandum.
Got it. Thank you.
Mhm.
Yeah, that's anything when they come out with new regulations from OPW or OMIG, it's an ADM, but it's just an administrative memorandum where they'll have a code, a date, an effective date, and the guidance. We
Just
love our acronyms in this field.
Yeah, just to be clear, it differs from a regulation, because a regulation is
Mhm.
Oh
something that
yes, I'm sorry. I used
goes
the word
into
regulation.
mental hygiene law. An ADM is a policy from OPWDD, but it's always good to have it be as clear as possible so that everybody concerned understands what's going on.
Yeah. Thank you.
Thanks, Rochelle. All right, I'm gonna go to the IAC, I'm sorry, OPWDD update with Nina, and then after OPW, after IAC, then we'll go to updates from the council chairs for the committees. All right, Nina?
Okay, thank you, and good morning to everyone. And Rochelle, just to add, you raised very good comments, right, and feedback regarding the core ADM, but the bottom line that we had to tighten up our process, right? We are implementing new application that will streamline the communication that is being submitted for the individuals who would like to be go on a pro list or need residential housing. From our experiences and challenges that we have at the regional offices, that often we did not have updated documents from the care managers and providers, right? And with this administrative memorandum going out, right, we are really improving our processes. So we'll see the results in a year, right? We are, I'm sure that the central office, they are monitoring the data, right? And as you have mentioned, there is a new process, NOD, Notice of Decision, that will be issued to the individuals, whether they should be on a list or they can live more independently. Right, and it happened so many times on our side where we put someone on the list when but when it comes to offering a placement, individuals don't want to go into the residence, and they would like to have more independent services. I'm not saying that this is the answer for everyone, but this is, this is the experience that we had on our side, right? So more to come. More to come.
Thanks, Nina. I agree with what you're saying in terms of, modernizing and streamlining and automating some of the procedures. That's all very positive, and I don't think anybody has any objections to that. It's really more on the decision-making process.
And also and also a big thing for us was having the updated documents, having the updated evaluations that truly reflect current abilities of the individuals. So
what stated in the ADM, and I don't know if it was, and was also reiterated by Emery Peterson, though, which was interesting to me, is that you would not, in fact, need an updated psychological evaluation, even if the last one was 10 years old, if there was no substantial change in the individual's status. Which was interesting, I thought.
There would be, but we would still ask for some sort of certification from the psychologist that that individuals remain at the same level, right? So we would not require new evaluation, but we will have some update or addendum to the initial evaluation that was completed.
Well, thank you for that clarification, Nina, because that was not addressed in the meeting. So I think or in the ADM. So I think that it's important for people to know that.
Yeah. So I'm gonna move to some updates. As everybody knows, the budget hasn't passed yet. There's a lot of advocacy of pushing the proposal, a lot of communication with elected officials. So thank you for that. So budget negotiations between the governor and the legislature still going into this week, but hopefully we will have executed budget soon. I think I have mentioned in the last meeting that we have a new service, home enabling supports, that will go into effect sometime in July, sometime this summer. Home enabling supports is a brand new service, which is a sub-component of adaptive technology, of assistive technology, and it's a waiver service. And the service will address persons' needs, people who are residing at home, to help them to maintain their relationship, to have more inclusion to the communities, and would give them people independently and meaningfully opportunity to live in their communities. And home enabling supports will assist staff to be more enabling supports will assist people to be more independent and less reliant on physically present support staff. Devices or supports received through home enabling supports include, but are not limited to, assistive devices, assistive technology, remote supports, and health assessment and coordination services. The service was recently approved by the CMS. We have 3 providers in New York City who will be delivering this service. This is person-centered services, human care, no, centered family supports. Hold on, I'm sorry. Human care will be delivering services in Region 3, even though they are a Brooklyn provider. For New York City, we will have Center for Family Support, ADAPT, and person-centered services. The service is for the individuals who are the age of 15 and older, OPWDD eligible, waiver enrolled, who not in certified setting, as I mentioned, and the maximum threshold would be up to $5,000 a year to receive. So currently, OPWDD is working on the trainings, is preparing providers, and we are making changes to our system because we will need to have a SART approval. We will have DTP1s. Central office is working with DOH on the rate setting and billing methodology. So hopefully, the end of May, beginning of June, we will have the trainings and more information will be coming out, and we will have the service ready to go in the middle of summer. Moving to the next item on my list. So we all heard all the federal actions, the recent court decisions. Within the federal government, the Office of People with Developmental Disabilities shares your concerns about potential cuts in federal funding for programs for people with developmental disabilities. As an agency, we are closely monitoring the situation. To date, there have been no changes that impact funding for OPWDD programs. On April 4th, the Senate passed a budget resolution, which, among other things, calls for a reduction of $880 billion in spending from the Energy and Commerce committees, which govern Medicaid and Medicare programs. The bill now goes to the House of Representatives, and if the House passes the Senate's version, the committees within both chambers will have to make recommendation on how to meet these targets. So we will do our best to keep you updated as we receive information from the federal government. We also received some guidance from the Office of General Services, OGS, of office language on federal actions. So the federal administration issued an executive order designating English as the official language of the United States. This executive order revokes that order that was implemented in 2000 and requires the U.S. Attorney General to replace existing policy guidance with updated guidance. However, this new executive order does not require or direct any change in the services provided by any federal executive agency. The executive order does not require federal agencies to amend, remove, or stop production of documents and products prepared or offered in languages other than English. The executive order does not affect the requirements under the implementation of New York State language access law. On the contrary, New York State remains firmly committed and fully prepared to support you and your agency in continuing to implement this law and ensure that all New Yorkers have access to services and benefits, no matter what is their proficiency of English language. If, as an agency, as an entity, you are receiving questions from the stakeholders regarding the diversity, equity, inclusion policies, you can send those questions to our counsel's office so we can review them and provide some support. And finally, I would like to quickly mention just one thing. Oh, so OPWDD, we entered in a 2-year contract with Elevers City. Elevers City is a nonprofit organization. We are working together on developing. They have educational program that will teach staff of a they have providers to help people to move into employment services and vocational services from day have services. And this is to support New York State Employment Initiative. So currently, OPWDD is working with DAHA providers, self-advocates, families, provider associations, and consultants to create a statewide plan to ensure that people have a comprehensive career plan and moving to employment as feasible. And we are working to reduce system barriers and disincentives that impede movement to employment and vocational services, in addition to increased community engagement. And the purpose of the training that we are working on, the curriculum right now, is to train management and staff of agency providers to teach interpersonal skills, safety skills, build independence, and increase community engagement to better prepare people for work. All right, and finally, in collaboration with Department of Health, OPWDD has provided updated guidance for management respiratory viral illnesses in OPWDD certified settings. These two guidance documents replaced the provided guidance for viral infections, which was issued last year in February of 2024. As COVID became more manageable, we have seen that Center for Disease, CDS, adjusted their guidance surrounding not just COVID-19, but all respiratory viral illnesses, such as flu and RSV. So we have further separated the guidance into recommendations for healthcare settings, such as ICFs and specialty hospitals, and recommendations for community-based settings consistent with the CDS. For community-based settings, the exposure to respiratory virus will no longer necessitate the quarantine of a program participant. Okay, so that's the difference. And the guidance is issued on our OPWDD website. And that's it for me for today.
Thank you, Nina.
Thank you.
Does anyone have any questions for Nina? And I can post in the chat for the communicable diseases, the updated guidance. Rochelle, you have your hand up?
Yeah, just quick, Nina, did I miss it? Did you mention that the CCO evaluation report is out?
Yes, it's actually, it went out. I think the official report is posted also on the website. I do not have the talking points for that yet. I hope I can present next month. There were a lot of comments. I believe there were like 70 suggestions for improvement.
An 855-page report.
So it would be nice to get a summary.
And there is, if you go to OPW's website, there is the 1 page. I don't know if it's 1 page, but there is the executive summary or whatever they call it. The plain language summary.
The executive summary is 25 pages.
Take that over 800. All right. Any other questions for Nina? I don't see any. Thank you so much, Nina. All right, now I'll pass it over to Kate from IAC.
And I'm just realizing I forgot to take my allergy medication, so forgive me. 1 second. I don't know if anyone else is suffering, but I'm going through it. Okay. Hi, Brooklyn Council. It's nice to see everyone. I'm going to have some other screens up just to check my notes while I'm going here. So if there's a hand up, I'll start by introducing my new colleague, Amanda Hinkson, who has just joined IAC. She is the VP of Adult Services. So Amanda and Brian, of course, if there's a hand up and I can't see it, just let me know. But welcome, Amanda. We're so glad that you're here. We are here as a resource, of course, for the Brooklyn Council. So if there are questions that providers have, Amanda, go ahead, drop your information in the chat if you haven't. And we, as always, are here for you. Providers, Brian, we all work together. Okay, so from IAC, Nina provided a lot of the information on the state level and federal level. The state budget, as we all know, is about a month late. Discussions continue. We had hoped that there would be a handshake deal towards the end of last week. There had been some rumbling of that. But here we are through the weekend. And as far as I knew, about an hour ago, there was no agreement. So we are still waiting for that. Members were in conference, virtually throughout the weekend. So all eyes are on the state budget. There was another extension last Thursday. So again, we are hopeful. So the issues that are still debated are involuntary commitment, discovery reform, masks, revenue for the MTA, and of course the foundation aid, which is how schools are funded here in New York State. The asks at IAC and our member organizations, we've been advocating for 7.8% targeted inflationary increase. Senate had recommended in their one House budget 4%, and then 3.8% discretionary increase, and then a direct support wage enhancement, which of course we would support. We did support. Continue to advocate for. And then the Assembly had recommended a 7.8% discretionary increase, unrestricted in their budget. The governor's budget had 2.1%. So again, please continue, insofar as we have the time, please continue your advocacy for that 7.8%. We know that it's going to be a real challenge, which is why, as much as possible in those debates, we'd like to remain top of mind. So for SED or state education, the majority of the budgeting for special education preschools and school age programs, 4410s for preschool or 853s for school age, is done outside of the budget process via a tuition methodology letter. SED submits that to the Division of Budget, and they're required to submit that by April 15th. And indeed, it did go in. I'm losing my time here. Was that last week or the week before? I think it was the week before. So that was sent to the Division of Budget. They take about 45 days. There's ongoing conversations that happen behind closed doors between SED and the Division of Budget to negotiate the request. But SED did share with us a draft of that letter. And while we can't discuss it substantively, just to let folks know that in summary, they requested, initially we had been advocating for a 3.1% growth rate. They included a 2.9% growth rate request in their letter to the Division of Budget. The Senate had included that 3.1 originally in their one House budget. The Assembly did not. So again, continuing your advocacy there for 3.1 we think is fair. But when the final letter comes out, just to let folks know that in general, we do maintain an alliance, or our advocacy is aligned with the State Education Department, who has supported our schools in recent years. And we've had some very important increases and changes that have occurred that have allowed our programs to stabilize financially a lot more in the past few years. So we will support their recommendation when it is finalized. The other aspects of that letter that we can summarize for you are 2.9% trend factor, 4% recommendation for multidisciplinary evaluations for special education, especially at going into preschool. And then a continuation of the 35-65 non-direct, direct cost screens, interim plus rates, including 2 previous years, the higher of for prospective tuition rates, $8 million for the excessive teacher turnover program, and then a 5% enrollment adjustment factor, which we've been asking for 7.5%, but SED has been recommending 5% each year. So for early intervention, we had asked for a 5% rate increase. Senate included a 10% increase. And as I think everyone knows, early intervention has just been horribly underfunded for decades now. New York State's early intervention program is really in dire straits. Our providers are in dire straits. Our evaluations are really underfunded. We had received some increases, but really nothing anywhere close to what's needed to stabilize the early intervention program and to get infants and toddlers evaluated and into services within a timely, within a legally required timeline. So again, IAC has been advocating for early intervention. We are going to recommit and reinvest this coming spring and then really summer into fall in our early intervention advocacy, aligned with our coalition partners, but also just in terms of IAC's providers to create a more targeted advocacy campaign around the early intervention needs. So just to preview that a little bit. Federal situation, as we've been discussing, continues to be incredibly unpredictable. We'll continue to provide information as we receive it, but wanted to thank everyone for all of the meetings that they've had, for the letters that you've sent, for the calls that you've made. And then in terms of the advocacy hierarchy, an in-person meeting is even better than a phone call, is even better than one of those one clicks, but they're all good. And whatever it is that you find manageable and can do, we thank you for it. I know you're advocating for the things that your families and the people that you support need. So maybe no thanks is needed, but it really does make a difference to have those personal conversations in support of these efforts, because there is so much going on right now and so much that is, it's called flooding the zone, right? Our attention is all pulled in a million different directions. So as much as possible, when you can reach out to your elected representative and let them know what matters to you and that you'll accept no changes, or you reject the dismantling of the Department of Education, you reject cuts to Head Start, to special education, to civil rights, Office of Civil Rights, right? We've lost both our regional Head Start offices and our Office of Civil Rights that maintains and upholds the legal requirements of IDEA and things like that. Watching what's occurred recently to HHS and the layoffs there, the dismantling of the Administration for Community Living, which is an organization or an agency that was in HHS that brought together in 2012 many different functions that serve people with disabilities and enables them to live in the community, and people with disabilities and older Americans. Just to let folks know a little bit more about ACL, a lot of what it does is it supports protection and advocacy organizations, so the disability rights organizations in every state. There's 57 of them, councils on developmental disabilities, Head Starts. There's lots of different aspects of ACL that were importantly together that enabled collaboration. It's really atrocious to target ACL. And then also Meals on Wheels, annually Meals on Wheels provides 261 meals to low-income Americans and elderly folks and people with disabilities. And it's, enables caregiver support. So we utterly reject the targeting of ACL and any programs that support people with disabilities in our communities. But again, just to continue your advocacy, I think Amanda may put some articles in the chat, but I have some as well. And just to end on a positive note, we will, of course, put some more resources in the chat. I mean, we want to hear from providers about the resources that you may find effective. There are some really neat materials out there that can help you just create one-pagers for your local electeds that you could provide to them about what would Medicaid cuts or public education funding cuts mean for your district, that might help them understand, what would it mean in terms of if we cut these funds for Medicaid or public education in our district or special education, what would it mean in terms of a tax increase, right? Well, how would we raise revenue to maintain the services that our community expects? So we can provide some of those. But just to end on a positive note, given all that's been going on, happy Autism Acceptance Month. It's really wonderful to be here in community with all of you. We wish everyone, for all of the events that you're holding, it can be a really difficult time, but just wanted to share in that celebration with you and say thanks for all the fabulous stuff that you're doing out there. Oh, I'm so sorry. I want to be done, but since there's no other presenter, I'll keep going just for 1 second, Brian, if that's okay. IAC is we have our conference coming up May 28th and 29th. Just to remind folks, we are going up for an education lobby day next May 6th on Tuesday and meeting with SED and our legislators to continue the advocacy on all of these topics that we've been talking about. We will meet with the state education department. We're meeting with some regents. We'll talk to Mike Benedetto on Monday and then other legislators. So we're looking forward to that. We'll report back on that. One more thing, and that is that there is a posed, there will be an opportunity for public comment on a proposed change to regulation. Pardon me, it's to the New York State Department of Health, Department of Health and Mental Hygiene Regulations, Part 679, related to Article 16 clinics. And it will be a further restriction that prevents Article 16 clinics, aside from the purposes of eligibility determinations. It will prevent them from supporting youth and adults with developmental disabilities unless they have an eligibility determination from OPWDD. So in the past, lots of kids who needed OT, PT, mental health counseling could receive their services, some of those services from an Article 16 clinic, and now they will not be able to do that once this is passed and adopted, which we are concerned will, of course, further restrict who is able to access services in a timely manner, and it will certainly delay at best, and if not, limit or restrict services to children and adults with developmental disabilities. So we will let you know whenever that is released for public comment, and my colleagues here at IAC will have more information to provide at that time. That's it.
Thank you so much, Kate. Both Amanda and I shared in the chat, if anyone is interested, the link to the IAC conference. And just so everyone knows, while there is a fee, there is a greatly reduced fee for families to attend. So you can get all that information on the link in the chat. There is a hand up for you, Kate. Paula?
Hi, Kate. Well, this is a hand up for actually for the council itself. I'm gonna suggest here the same thing that I suggested at the Queens DD Council. I think given the times in which we really need to lean in advocacy, perhaps it would be a good time for the councils to develop like a subcommittee on policy with the purpose of, circulating everything that is, that we can do as an individuals, obviously, and to make aware to the families on sign-on letters or, sign this for your senator or whatever. I think that we have to be a little bit more in sync with the people that we're serving, the consumers, the families and all that. If we send them, if it is a subcommittee, keeping an eye of everything that is going on, we don't have to wait until we meet monthly to start circulating, because we are living in very, very challenging times. And I think a reaction quickly is what it will be most effective. So I just putting out there for whoever have the time to join a subcommittee in policy, just with the purpose of keeping us informed and in tune. And those, those letters actually takes less than 2 minutes to, because, it's already created. You just need to put your name, and so it will be sent to the appropriate senator and all that, and you just click send, and that's it. So I think we ought to do something like that to strengthen our, our voice and to, participate as individuals and as a council. That's all. Suggestion out there.
Yeah, no, I think those are great suggestions, Paula. We do have a legislative committee for the Brooklyn Council. No one attends it. It's usually a bunch of us co-chairs and chairs, and so we've struggled getting family involvement, participant involvement, other agencies involved. But we definitely do have a subcommittee that meets an hour, the legislative subcommittee. It meets an hour every month on, I think it's the second Wednesday of every month. um Lucina and Maria Willis from Lucina from My Time Inc. and Maria from CP Unlimited. They're both here. They are our co-chairs for that committee. We try desperately, like we try to do what you're saying to spread the information. I definitely share out the one-click letters. It's, I think, the second pinned post on our website is to the Anchor website on the advocacy toolkit and how to be an advocate. And Anchor is great at getting those letters out. But I think some of the issue is it's email burnout, where we keep sending these one-click letters and they just go into the inboxes and no one does anything. From what I've heard, whether it's through IAC or Anchor or NIDA or other initiatives, phone calls have been much more effective. Obviously, showing up in person is probably the most impactful, but phone calls have also been proven to be a little bit more effective. And I think it's just post-pandemic, it's very easy for all of us to keep sending emails, and they've gotten much better at just kind of ignoring them. Um, so while those are good, like we need to hit them from every angle. If people are in your local districts, in
Right.
your cities and your towns, like get out, make a visit, make sure your face is seen. I try to encourage the programs to do that, whether it's with day programs, residences, make visits, give out information, give out flyers, have a personal connection. The more they can make a personal connection, a family telling a story versus them receiving a letter that they can easily ignore. I think it's all impactful. But
I,
yeah, so that's a plug. Thank you, Paula. Please come to our legislative committee.
I
Please
totally,
come to
I
our
totally,
legislative
I
committee.
totally agree with you. And perhaps another suggestion, if because you're already doing the work, you already have a subcommittee, you're already meeting about this, perhaps maybe you can create an email that it will say advocacy or BBD. So we know that this is different than the regular ongoing general email. So that way we will pay attention and say, oh, when it comes from advocacy from BDD, is something that requires an action, something for us to click on and all that. Of course, in person is ideal and all that, but believe me, when a council member, a senator get 100 letters in a day, that's something that is going to catch their attention. And I really, really, the difference is in the numbers. And
Yeah.
the stories are really, really good, but the difference in the numbers, when they see their emails overflowing with a lot of people supporting and advocating for a particular issue, they pay attention.
Yeah.
That's all.
No, great points and ideas. So please attend our legislative committee. Deborah?
Thank you, Brian. Kate, nice meeting you. I'm Deborah Greif, Chair of the Brooklyn Family Support Advisory Council. Most important, I'm a parent. And I know IAC is an agency that represents the actual agents, but I didn't feel very welcomed because, my council, as well as a lot of my families, we have been advocating because we do not want anything to happen to any of the OPWDD agencies. We want to keep them running. We are fighting very hard. Yes, we have done, and I do co-chair the Family Provider Information, then legislative follows, and I do get a lot of my parents from the advisory councils have stayed on. They've actually do show up. They have gone to officials with pictures of their children with them. And we've constantly invite them to show up to our virtual meetings. But we know we are competing against other groups, but our new policy is that we're not going to just advocate during budget time. We're going to do year round. And I know that when Lucina Clark and Maria Willis speaks, because we do have to keep this up. So just like include us a little bit, because you know what? Every time they hear, like they'll say to me, well, I know the agencies are coming because they need the funding, but it's more powerful when you say, let's get the parents trained also. We have to keep updating trainings for families so they know how to speak to a legislator, because sometimes they are so angry, they yell at them. That doesn't help us. So we need to they understand the urgencies and what's going on with us. So we need more parent and family training, because there are a lot of families who are siblings who are there, they care for their sibling. So those are my couple of suggestions. And yes, all the advisory councils across the state have been advocating very hard against the cuts to early intervention, preschool, education. We're not very happy with the threats to Medicaid. We are not very happy with misconceptions of what's been said about what people who have autistic in the autistic spectrum. So we are doing this, but please include us a little. Thank you.
Deborah, I
Kate,
did,
you're yeah.
sorry, is it, Brian, is it okay if I jump in?
No, I was just gonna say you were muted. I saw you were talking.
Sorry, thank you. Deborah, I couldn't agree more. IAC is looking for more ways to, we're a provider, we're a membership organization. And so we're looking for some ways to, we know that the organizations that we support are first and foremost there to support people with disabilities, and then also, of course, families. I come from AHRC, which is, family governed organization. Many of our organizations we're nowhere without families. I mean, period, bottom line, services don't exist. The organizations don't exist. The agencies don't exist without what families have done and do. So thank you. If I misspoke or if I didn't include families, I think we all take our cues from families, and first and foremost, people with disabilities and then their family members are the most effective advocates. And anything we should do and can do should amplify your messages. Absolutely. Thank you.
Thank you very much. And and I know that if you need, you're more than welcome to show up if you want to do a presentation to explain to the families, you're more than welcome. And also, because anything that's IAC puts out, we put it on the advisory council's website. Brian and I constantly are putting things on. So, and the reason why you're not seeing Christopher Greif here today, he's at 2 Broadway for the MTA, making sure that we get more elevators and making sure that the trains are truly accessible. So, and also because of Autistic Spectrum Month, he has to be there. Okay?
We thank you for that. And also, so it's good to hear, because I know, I'm seeing Lucina there, just all the incredible work that you do with families, and the DOE in particular, I know, looks to you for feedback, right? For direction, for how are we doing? And so we want to amplify that relationship, and also we learn a lot from how you do business, right? But in particular, I think your point about advocacy occurring annually throughout the year, not just during budget season, is a really important message that I'll take back. And I know Winnie is looking for ways. We're looking for new ways to communicate, levels to communicate that is, sure, for leadership or for provider organizations, but also for families. So I'll take that back to Winnie, and hopefully we'll have some more for you soon. And if we have some questions, we'll come and ask the families that are here.
Please do.
As well. And
Please
Brian,
do.
of course.
Thank you very much.
Thank you.
Thank you very much. Appreciate it. Thank you.
Carrie, you have a question for Kate?
I do not have a question. I'm sorry, Kate, but it's great to meet you. I'm Carrie Banks from the Brooklyn Public Library. I have a comment. Lots of electeds, city council, the state assembly, the state senate, lots of local electeds hold hours in libraries throughout the borough, and it's a great, easy way just to walk down the street to meet and engage with your electives and to advocate, particularly for our families, and for individuals to advocate for themselves. It's a very powerful thing, and I would encourage you to take advantage of it.
Thank you, Carrie. All right. Kate, I don't see any more questions from you. Thank you so much for your update. And if anyone does have questions, kate@iacny.org is her email, or you can email me and I can get it to her. Either way will work. All right. I know we have Rihanna here. She doesn't have any updates from DOHMH, but I just want to acknowledge and thank her for being here and participating in our meetings. So now I'm going to circle back to the chairs of our committees on the council if you want to give updates and plug upcoming meetings.
Good morning, everyone. It's Melissa. The residential committee will be meeting on May 9th from 4 to 5. I will be sending Brian a flyer today. And the hope is that Advanced Care Alliance will be presenting on the CROW as well as residential placement eligibility.
You said May 9th?
Yes,
All right. Thank you, Melissa.
you're welcome.
Debbie, Lucina, Maria. There you go. Go ahead, Debbie.
Hi, I'll talk. Hi, everyone. Good morning.
Uh,
This is Lucina. Thank you so much. I see my co-chair Maria. Thank you so much for all that you do. I just want to say thank you first. A few of the agencies who, Brian, thank you for sharing the event. We had a Bikers for Autism event here on Saturday. We had over 350 bikers showed up supporting autism awareness. It was unbelievable. Carrie, thank you for your two amazing representatives. They had a blast. I had parent to parent. I had someone from YAI, Deborah, and a few agencies were unique, me creatively. I was so floored by these bikers and their love and their appreciation for all families of children with autism. It was awesome when the weather held up, thank God, and to see a ray on 640 Parkside with Nostrum and Rogers blocked off and 350 leather-cladded, handsome-looking men on a bike. I mean, our parents, I had one parent who was very sick for our gala, and she was in a wheelchair and walker. And she said, I'm going to make it. Oh my God, my heart, when I saw that woman, she got sick. She fell, she was in the hospital and in rehab. When I saw her showed up on that accessor ride to be on that motorcycle, my heart, it was the most amazing, miraculous thing I've ever seen. So thank you all. Thank you, Brian, for sharing that. You know, thank you so much, Kate, for what you do and what we do in as far as legislation, because I've always been involved in making sure parents know that they have the power. Their voices and the individuals with disability have the power. You know, all we need to do, as we say, how can we teach you? What are the words to say? What are the questions to ask? And that's basically it. If you understand what's a question to ask or what to say, or how to share your story. Sharing your story is so important and vital as a parent. You are the one walking in this shoe. You are the one, we may empathize with you as the providers, but what are the steps you're taking as you walk in your shoe? Some people take baby steps. Some people take bigger steps. Some people take humongous steps because they may be more informed. And it doesn't mean to say that I tell parents, when you have a child with a disability, you are an advocate in every sense and form. You are the voice. So when we have this meeting, yes, we want some more parents to be involved. And you know what? It's okay if they don't get as much involved, but we give them different tools. Like Brian was saying, we do the email, we do different letters, we do different formation, because I'm background as an educator, multidisciplinary, visual, auditory, you know, you use all levels of approach to help our parents. So I know Maria and I will reach out to you, Kate, as well. Let's have those conversations, because conversations are important to be had. And through these conversations, like we were saying, we advocate every year round. Because how do you feel? It's like, when is like April, January, you're coming to me. Why should I help you? You only need me then? We need to be in their faces all the time. And thank you, Carrie. I want that list of, I'll make sure we get information like when they are praying, despite wherever they are, whatever district you're in, at least we have that information to be sent out so families can be involved. You know, all our parents, we make sure we send out that email all the time. Come onto these meetings, be involved in that. Even just walk over. Thank God in my district, in District 18, we have Senator Prasad, we have Jamie, all of them who are, you know, so involved. Our parents go to their offices. I said, go, walk in, introduce yourself. You know, get involved in the community activities that we have. Go to our 69 Precinct Council meeting. Go to Community Board 18 meeting. Get involved in civic associations. They can see you. Bring your child. I don't care if your child cries, scream, bring your child also. so they can see your child. So I know Maria was one of up in Albany more than me. I do connection of my locals down here. I am so excited that I have that communication and that connection with each and every one of them. They respect me and I respect them. I don't need you only when I need you. I need you because I appreciate what you do as well. And that's the message we have to give as well, you know, as the agencies. We can't say, oh, I need you only now because I want you to change the budget. Hell no, I wouldn't do it. When you see me every day and you appreciate what I do, I'll say hello. Thank you for thinking of us and what we do. That's the message we need to have. So
Lucina, you're
thank you,
giving it all away
Maria.
for free. You got to leave something for them to want to come to your monthly meeting. You're giving it
I
all away right
know.
now. You got to let them, you got to keep them hanging
But
on
I'm
a little
gonna
bit.
leave some. Don't worry. Brian, you know me. I'm always full of ideas and experience. I had an amazing weekend. I know I came from Florida for the week. We drove. My husband loves to drive to Florida. So we took our grandkids for the week. We drove back. Then I had to leave. I was in a convention for the last 4 or 5 days, come back from Baltimore, do the event, go back to Baltimore, finish my convention, and come back in for this morning. So I'm telling you, when I'm fired up by things that I see, I will share. I have enough energy and enough ideas in me that I will share. So please come. Our meetings is the second Wednesday of every month. We do a collaboration with Deborah's and their meeting. It is very powerful. The
At
people
11
there, the
a.m.
ideas, some parents are there too. Even if one parent show up, that means you are valued. It doesn't matter because that one person, that one parent may have an idea that spins everything around and makes it as amazing as ever. So thank you. And my co-partner, Maria, who's like, she's always up in Albany, so that's her position. I don't want to risk because it's almost
So for the
connection
next
thing
episode
and
of the Lucina and Maria Legislative Show, you can tune in on May 14th, 11 a.m. via Ring Central.
I just wanted to
yes.
No,
add
it's
two
not May
Thank
things.
you.
Can you
14th.
hear me?
I have the date.
Can you hear me?
Go ahead,
Yes.
Yes,
Maria.
Maria.
I just wanted to
Yeah.
add two things to what Lucina said. Second Wednesday at 11 a.m. And also we are planning to hopefully
May 8th.
Lucina May 8th.
May 8th is the second.
Yeah, second Wednesday of the
No,
month.
Yes.
May 8th is a Thursday next month.
Second
No,
Wednesday at
second.
11
I
a.m.
have the
While she get the
calendar.
date, let me just mention two things. For the family support fair on June 18, hopefully Lucina Table and Minds will be together, but we're planning to support and help parents in terms of how to get to the links, show them
Right.
how to get to the links at the time, and answer any questions they may have in terms of legislative questions. So if Lucina and my table are together, we'll be supporting the parents that come to the family fair and helping them to get all of that information. Secondly, and it was already mentioned, the ongoing advocacy, not only the providers, but providers helping families to continue the advocacy locally, and the people we serve as well should also advocate and go to the legislative office and advocate. There is a letter that went out. I didn't hear anyone mention it. Mostly Republicans from representative from the Republican Party that sent out a letter to the Speaker Johnson, the Majority Leader Scasleys, and the Majority Whip Emmer, and they mentioned, and I'm just going to read this part that they wrote to him advocating for us. We support targeted reforms to improve program integrity, reduce improper payments, and modernize delivery systems to fix flaws in the program that divert resources away from children, seniors, individuals with disabilities, and pregnant women, those who the program was intended to help. However, we cannot and will not support a final reconciliation bill that includes any reduction in Medicaid coverage for vulnerable populations. And it was like 12 of them that signed on. And I specifically want to mention Congresswoman Nicole Meliatakis. She covered part of Brooklyn and part of Staten Island. But if we could continue to advocate
All
for
of Staten
those,
Island, Maria.
if we continue to advocate for those that are not signed on this letter, call their office and ask, why have you not signed on to this letter advocating that services are not cut for individuals with disability? And if they say they don't know about this letter, then we could send them the letter saying, look, some of your counterparts signed on to it. Why are you not signed on to this? So I just wanted to bring that out there, that there
Right.
is a letter of some of them, and we just got to continue that these that are already signed on will continue to push that there's no cuts to Medicaid. That's all I have to say. Thank you.
Thank you, Maria. That's why,
You're
when we
welcome.
come together,
Okay, I have
powerful, we have
Brian, look,
powerhouses.
and Lucina, I have to make a correction for the date of the meeting. Brian
Okay.
is correct. It's going to be Wednesday, May 14th.
Okay,
First
thank
the
you.
family provider, then the legislator committee.
Thank you. But again, I want to thank the team, Maria. I mean, listen, Boston getting that, I'm the connector. Maria goes up there to the legislator and she's really on board and on track. And that's why I'm glad we're a power team. And, our role is really to educate and help you advocate. And when you have those two coming together, and do it with love. With me, I can be harsh on some of my love, but it's a good love. Tough love is good. Tough love is good sometimes. So I want to thank you. And thank you, Brian, for all that you do as well in making sure messages, emails are sent out and doing as much. And, we have Rachel here. I want to tell Rochelle, thank you too, because she's such a strong force. So as a parent, in making sure these legislators are doing their job too. So I want to thank you as well in just giving information, all the committees and whoever joined us, so we can be a strong force, because we have to continue doing now is more than ever. So let's all stay focused. Let's stay committed. Let's stay, like pit bulls, making sure, like Maria was saying, recopy that letter, send it. So, why aren't you doing it? Let them get the face off as well. So thank you. And I hope you all going to have an amazing, amazing, amazing week. I'm taking my parents on a retreat. They can't wait. I can't wait to have my meeting with them. So we will have an amazing time. So again, Lucina Clark, I am the co-chair of the Legislative Committee, also executive director and co-founder of My Timing, a very special place for parents of a child with disability. So thank you. And Kate, I'm going to email you. I'm so
All right.
happy that you were
Thank you,
there.
Lucina.
You're
Real
welcome,
quick,
Brian.
Rochelle, I see your hand. I just want to touch on Maria's point really quick, where she said that they're going to have tables where parents can come. One of the things last week, there was a meaningful day committee for the Brooklyn Council, and one of the conversations that we were having was to have some Ask the Expert tables. So we're going to have that organized for the fair as well. So not just getting information from agencies and services, but some agencies that specifically focus, or professionals that specifically focus in different areas, whether it's children's services, transition services, employment services, residential services. We're going to make sure we have some tables set up in space where people can go and have real conversations, not just hearing agencies trying to sell them on their services and to sign up with them, but to get real details and information that can help families maneuver through the OPW system. So I'm glad you brought that up, Maria, because that was a separate conversation that was had in another committee as well. So that will definitely be happening at the June 18th event. Go ahead, Rochelle.
Yeah, well, first I want to echo what Brian said. We have so much talent in this council and so much knowledge that we must share with parents and other advocates in our space. So I think this Ask the Expert, using our own resources, is a really, really good initiative for us to do this year. But I also wanted to address what Maria was saying about this Republican letter that some of our local Republican Congress people sent to their speaker. I think we have to exercise some caution. I think they wrote this letter in response to tremendous pressure from their constituents about concerns about Medicaid, and that's why they felt compelled to do that. But they parsed their language very carefully. We don't know what their definition of a vulnerable population is. And the reality is, even if they say that people with IDD, their services wouldn't be cut, if they cut state Medicaid funding as a whole, it will inevitably have an impact on our services. This is a divide and conquer a strategy on their part. So we need to tell them they should not be cutting the expanded Medicaid, adding any restrictions onto Medicaid, that Medicaid is critical for the health and well-being of the entire New York State population. So The other thing I wanted to add is that the New York State Developmental Disability Advocates, the provider group, and CP State have generated a campaign, Guardians of Medicaid. And they have a whole packet of materials that they have sent out to all Congress people.
Did we not share that? I'm sorry, Rochelle, to interrupt you because you're saying really important things, but I thought, Amanda, we'll drop that in the chat.
Yes, please.
Yeah.
Please drop it in the chat and we can send it. I'm sure Brian will circulate it for the people who are not here today. It is critical that we ask our Congress people, Democrat and Republican, to sign onto this letter and to post in their windows of their offices that they are a guardian of Medicaid. And this is really and it's something that when we should go to their offices and drop this letter off and make an appearance, because I agree wholeheartedly that showing up in person has the most impact. And if they get person after person coming in with this letter and, going to their staff, they may not see the congressperson, but the staff will be getting it and they will convey to the congressperson, listen, we're getting deluged with requests for you to sign this letter. And it will keep the Democrats honest and may force the Republicans to broaden their resistance, because the details of the budget, the federal budget, are coming out very, very soon. And so we'll see what they really intend in terms of Medicaid. And I don't expect good things.
Thank you, Rachel.
Yeah, Kate.
I put in the chat, sorry, I was trying to make sure I was unmuted. I'm looking for where it is in the chat. There are some draft proposals for what they are looking to cut. Those conversations and reconciliation are happening now. Reconciliation, I'm sure you've heard, is a special process by which you only need a simple majority. So they have the votes, insofar as they are not worried about any particular item, being the thing that prevents their reelection. If I go back a little bit in the chat, it's I'll repost it. There are many proposals that you can look at and identify, what's important to you. If you're talking to your local legislative representative, you can point to some of these things and say, I expect that you will not in any way ever support this, or we're looking at this because you're right, Rochelle, about the divide and conquer, right? That we are, insofar as our workforce is supported as we, benefit here in New York exponentially from Medicaid and how incredibly wonderful it is for our infants, toddlers, families, the people who support people with disabilities, right? Any cuts to it are going to be devastating, not just school services, long-term care and supports. It is all, a net, as you said. I'm sorry, I'm going to mute myself, but I couldn't agree more with what you're saying. And if you want to look at some of those proposals, this document is quite a few pages long. These things are not particularly detailed, but since I don't think you need all the details, right? You can look to see the extent to which these are dollar amounts that are associated with this, because they have to get to 880 billion or as close as possible. And that means cutting services, period, bottom line. In order to pass these tax cuts, they have to cut billions and billions of dollars. So all I'm trying to say is there are proposals out there and they're all severe.
Thank you. All right. Any other council committee chairs? Debbie. Oh, and Debbie, you also
Yes.
want to give an update on the advisory and Chris's MTA update, right?
Yep.
Go ahead.
Yes. Okay, first, I want to do the family provider information. Our last meeting was Wednesday, April 9th. She did a great presentation, helping us to understand how we can help our families to understand their services and work together. Then, of course, we were then right away after that, we had legislative committee with Lucina and Maria. I want everyone to know that subcommittee is on Ring Central. The next one will be Wednesday, May 14th. Now, I want to announce that tomorrow at Coney Island Hospital, the HHC public hearing will be there starting around 6. Bronx is on May 20th. And the reason I'm bringing this, there's been issues with when our children are admitted or stay in the emergency room, we're supposed to be with them because many of our children, or if their direct care staff comes with them, they cannot speak or communicate. And they have been starting to block this, where we originally had an agreement they would not, especially if the person who cannot verbally speak at all. So if you cannot physically make, you can email them your testimony, or and if there if the I couldn't write all the website, but you can go onto the Brooklyn or the Brooklyn DD Council's website where you can communicate through to the hearing. Now, the last advisory council was last Tuesday, April 22nd. We did discuss about the upcoming RFP readings. As you know, Brooklyn's priorities were housing advocacy, housing for adaptive equipment, and for behavior modification for children with challenging behaviors. I do not have a date when the advisory councils are going to be reading it, but it'll be an important. This is very important because we want to make sure we keep family support services running, especially, and the reason we picked housing is number one, a survey was done by the statewide advisory. Brooklyn had more than 200 responses. All I kept seeing was housing, housing, housing. Realizing that, and I've had issues with housing too, where you have to go to housing court. It's very important when you're coached to say and do the right thing, so you do not want to become homeless. So that's a really important thing. Our next meeting is going to be Tuesday, May 20th. It'll be the day after the Brooklyn DD Council because of Memorial Day. Now, we also, as you know, the Advisory Council is partnering, and thank you, Carrie, with Inclusive Services. This coming month, it's going to be last Friday, May 2nd, at the Washington Irving Library, and that's going to be on 360 Irving Avenue at Woodbine Street. We have no more tables available, but every agency is invited to come and leave your information with us. The library has done a fantastic job of spreading the information around to everyone. We did great at the previous one, the McKinley Library, that was in the border of Sunset Park. We helped a lot of families. I thank every agency that participated. Now, I'm giving Christopher Greif's MTA report. Very important. As you know, it's Autistic Awareness Month. And Christopher was one of the speakers, and we have 2 individuals from Brooklyn who were from My Time Inc. that were able to make the announcements of upcoming trains, and they had a great time because they were happy to meet the director for the disabilities, Mr. Q, or everyone knows as Quimel Ario. These kids were so happy, and it's going to be these 15-minute intervals. You're going to hear their voices up until April 30th. It's going to be, we're going to work to make sure that more individuals, there'll be more things to be involved with. Now, we've seen that Chris has been emailing about select station for accessibility upgrades. Whatever train station you feel needs to be upgraded with an elevator, escalator, really ramps, please do. It'll be on the website and I will put it into the chat. The next thing is, excuse me, sorry. We're asking everyone to do an MTA launches Spring 2025 Customer Satisfaction Survey. It will be on from Monday, April 21st to Sunday, May 4th. Please let them know what's working and what's not working. The more you have your voice heard, the more that you will be able to improve our system. It's very important. And reason Chris is not here right now, Chris is right now at the committee reports for the MTA to make sure that one, accessibility is built into the full system. And it's also not just accessible train stations. We have to improve the tactile on the edges so that nobody accidentally falls over. It also, we need to make sure that there's a couple of new devices that are being made for people with visual disabilities, also for hearing. So we need all types of upgrades to make sure our system is going to be completely accessible. So with that, also, as again I said, if you have need any help with us, please contact us through our website, which is bfssac.org. And we appreciate, and I want to also thank you, Brian, for your being able to work as a partner. It's been a great pleasure and we're enjoying it. And please, if you're asking about for the election, please email me at deborah.greif61@yahoo.com. And I will be working on the election as the chair of that committee. Thank you.
Thank you for all those updates, Debbie.
You're welcome.
Any other chairs want to plug their upcoming meetings for the council? If not, we'll move on to announcements from agencies. I see a real hand, not a virtual hand. Go ahead, Carrie, and then Doris.
Couldn't find the button.
It works.
It did, surprisingly enough. So we have all kinds of really exciting things going on. Thank you, Deborah, for mentioning the fair. But the one I really wanted to talk about is tomorrow. Tomorrow night from I think 5 to 6. We have Gary Schulman is returning to New York City, and he's going to be speaking essentially about life planning. The title is "When I'm Gone, What Happens Then?" And this is something I know we don't like to think about, we don't like to talk about, but this is something that's absolutely so critical for us to think about and talk about. We need to be doing this planning for our children after we're gone. So I will put the information in the chat again. It's free, it's virtual, it will be Zoom. People need to email me or call me. I'll put the information in the chat for registration. But please encourage people to come. Please come yourself. I mean, even if you're not necessarily a parent, you are obviously interested in the lives of people with developmental disabilities. And the more that you know, the more that you can share with your families and people close to you. So I'm going to put it in the chat. I'm not going to talk about any of the other programs today because this is the one that's really important. So thank you and have a great month, except for those of you I'll see in other meetings in between.
Thank you, Carrie.
Oh, you should
Doris.
have great months too. I'll see you soon.
Good morning, everyone. My name is Doris Kahn, and I am the Outreach Coordinator for New York State Institute on Disability. We're a family support agency. Summer is here, finally. We're getting this good weather, and summer brings to mind camp, and NYSID provides reimbursement for camp. Those of you who are interested in camp reimbursement, please contact Jackie Tripodi at nysidinc.org or I'll put her phone number in the chat. Thank you. Thank you very much.
And if you would like to meet Doris or any of her staff from NYSID, they will be at our event in June. So another reason to come and visit. They will have a table. Any other agency announcements, openings, anything anyone want to share? All right, quiet month. So I will just plug, make sure you go to our website, bkddcouncil.org. We have the calendar. Anytime we have meetings, they are linked on there, whatever platform they will be on. Lots of announcements go through there. If you're not on our mailing list, you can sign up on our website. And Erica, go ahead.
Hi, good morning, everyone. This is Erica Thorpe from Heaven's Hands. Just wanting to let you know that we have openings in both of our Brooklyn Day Hab locations, Sunset, as well as East New York. And we also have openings in our respite programs and our ComHab programs. Any questions, you can always email me at ethorpe, ETHORPE, at hhcsny.org, and I will also put the information in the chat. Thank you.
Thank you, Erica. Lorraine?
Hello, good morning, everybody. My name is Lorraine Keneal, and I am representing OPWDD eligibility through ABA enrollment. We are actively providing ABA services in the home alongside home care, OT, PTSD, and HHA as needed. We continue to provide ABA for adults over the age of 21 as long as the doctor and Medicare is involved. We don't usually get too many denials on that. We have openings in all 5 boroughs. Brooklyn has the most available in-person staff, whether it's behavioral, registered behavioral, or BIS. Parent training is available, and transition services are also available for teenagers, preteens, and adolescents into adults. You can contact me with all inquiries, questions at info, INFO, at Strive High, STRIV like Victor, E like Echo, HIGHABA.com. My direct email is L like Lisa, C for cat, ON like Nancy, ILLE at StriveHighABA.com. That's it. Thanks, guys.
Thank you, Lorraine. Also, Strive High is one of our sponsors for
Yes.
the fair. So thank you, Lorraine, for that. And so if you can also come meet them at the event in June, they will have a table there, and we are very gracious that they are one of our sponsors for the day as well. Lindsay?
Hi, good morning. I'm Lindsay Stilson, Outreach and Marketing Specialist for Goodwill. We have openings in our Brooklyn Possibilities, which is located in downtown Brooklyn. This program is blended services of day hab without walls and community-based pre-voc. We also have openings in respite, SEMP, and our advanced services. If you have any questions, I put my email and phone number in the chat. Thank you.
Thank you, Lindsay. And Goodwill will also have a table at our event. Just come meet everyone. Sign up. Be there. All right. I believe that's pretty much it. You guys will get a half hour back in your days. Thank you, everyone, for being here. Have a great week. Have a great month. Hopefully, we'll see you at our committee meetings this month. And by tonight or tomorrow, this meeting will be posted on our website for anyone to be able to access, look back, and find the chat. Have a great week, everyone.
Thank you.
You
Bye.
too.
Thank you,
Bye-bye.
Ryan. Bye.
Hey, everyone.